Hi, I'm Dr. Stephen Stokes. The third step to innate healing is digestion. Okay, lots of problems can happen with digestion. Let's start in the stomach. So if you have problems with digestion, the first thing is you want to increase your digestive enzyme intake. I recommend Enzycore, which is a vegetarian formula, or Zypan, which is not vegetarian, and Zypan contains acid. They have to be careful. Most people need more acid in their stomachs, not less acid. But if you have an ulcer there already, which we're going to cover in a minute, you don't take Zypan. You start with Enzycore, and then once the ulcer heals, you can switch to Zypan. You take 1 or 2 of these little pills, these digestive enzymes with each meal, helps break down the food, especially the proteins, so that these molecules don't pass through the stomach lining and create an autoimmune disorder called leaky gut in your system, which is very common. Now there's other problems that can happen with the stomach, like I mentioned. You could have an ulcer. So if you have an ulcer already, number one thing is go get a test for H. pylori. If you have a positive H. pylori test and you have bacterial infection in your stomach, before we do anything, we're going to kill the H. pylori bacteria. I like using garlic for that. I get garlic from a company called MediHerb. There's also a product line that comes from Standard Process, and these are whole food concentrates of garlic extract that you're going to take on a daily basis that's going to kill the H. pylori bacteria. Once that is dead and your blood work shows or your breath test shows that there's no more H. pylori infection, then we can heal the ulcer. Now, to do that, we use a product called Okra Pepsin. And Okra Pepsin is a product made from, I believe, from young, unripe bananas, and it puts a slick, sticky surface in your stomach that will coat your stomach, that will protect the ulcer until it heals. So we'll start with that. If you are having problems with acid reflux, heartburn, these types of things, but you don't have a severe ulceration in your stomach, the digestive enzymes may help, but if that's not enough, then I will prescribe a product called Gastrex from Standard Process. And Gastrex is just a good general support for the stomach. It contains a lot of useful things. There's some healing clay in there. These are things that are just going to help your stomach heal. Okay, also for healing the stomach, actually for healing any part of your digestive tract, chlorophyll complex, which is one of my A1 items for every step is chlorophyll complex. Again, chlorophyll complex, you take this, you take up to 9 of these a day. The molecule of chlorophyll is very similar to hemoglobin, and so it helps to bring oxygen and bring blood flow into the parts of the body that are damaged. So chlorophyll complex is like a go-to product for any type of healing. So we definitely want to use that as well when we're talking about the digestive system. A lot of people have acid reflux and they don't know why. I think it's because they eat acidic foods. That's really not it. Most people that have acid reflux have GERD. The sphincter, the lower esophageal sphincter in most people is weak. And that sphincter, when it gets loose and it isn't tight anymore, allows some of the acid to come up through it. In my experience, giving patients calcium lactate really helps to tone that sphincter. Also, we use a procedure called PEMF, pulse electromagnetic field therapy, where we put a strong magnetic field into that area where the sphincter is, and over a course of maybe a couple of weeks, we can tone the sphincter, and that can be done without surgery, so people don't have to get the ring put in there, which is kind of invasive, you know. Gallbladder is a big problem for a lot of people. If you don't have a gallstone, then you can take some general support for the gallbladder. Betafood is really good for that. We talked about that in step 2. Betafood is basically a beet extract and sugar beet extract. And this is really good for the liver, supports the gallbladder. It's going to be very helpful. But if you have gallstones already, we really want to increase the bile concentration coming through the gallbladder, because that's why gallstones form, you know. Gallstones form because of stagnant bile, basically, in their gallbladder. We want to get that bile moving. So a lot of times I'll put patients on this AF Betafood. And it's a derivative of the Betafood supplement that I mentioned before, but this time it's more geared toward the gallbladder. It's called AF Betafood. We're going to take that several times a day, and it's from Standard Process. Plus we're going to take choline, and we're going to take Phosphofood liquid. And the choline and the Phosphofood liquid together are going to help to break down some of that density in the gallstones. So it may not eliminate it completely, but they do soften the stone. And we increase the bile production by taking Cholacol. Cholacol is a product that is basically bile salts. You take that and it's going to really improve the dynamic flow of bile through your gallbladder. And that's how gallstones start in the first place, right? Through a static flow. I remember a long time ago when I was experimenting with different diets, I went completely vegetarian for almost a year. And I cut out a lot of the saturated fats, and I cut out red meat, and all the meats, in fact. And as a result of that, I developed a gallstone. My gallbladder wasn't, working like it used to work. I wasn't needing as much bile to break down these fats. And as a result, it became kind of static in there. It wasn't dynamic anymore, and the stone formed. And these products, the AF Betafood, the Choline, the Phosphofood liquid, and the Cholacol, together form my regimen for helping me with my gallbladder. And I'm sure it'll help you as well. The colon is all about the flora, getting enough good bacteria in the colon. Probiotics don't work very good, but there are a few that I've tried with some limited benefit. I have given patients Prosynbiotic, which is a standard process, sort of general purpose Flora supplement, probiotic supplement. It seems to work okay. We'll do that. There is a product from MediHerb called Gut Flora, which is even better because Gut Flora is going to bring herbs in there that are going to help your body make more of its own flora. And that's kind of what we're after. But the ultimate way to repopulate your own colon is through fermented foods. The best one is cabbage. In my book, I talk about how you can chop up some cabbage and make your own fermented cabbage drink in a few days. It's cheap, and it is the very best way to repopulate your colon, is with that delicious cabbage drink. If you're having problems with constipation, disodium phosphate is a great supplement to take from standard process. And disodium phosphate will produce a bowel movement because when you take it, it's going to go right through the system. But also it's a good way of toning the bowels. So with regular use, the bowels get trained like a muscle almost, and they become more efficient. So a lot of times we'll prescribe disodium phosphate, or there's another product called Cholax. Cholax is really good as well. So the combination of disodium phosphate and Cholax, both from standard process, they're going to get rid of just about anything that you've got as far as being constipated. 70% of the immune system has to do with your gut health. So if you're having problems with your gut, if you're having problems with your digestion and your digestive system, there's a high probability you're going to have problems with your immune system as well. The immune system is the next step that we're going to talk about, but just to touch on that briefly, when people come to me and they have problems with the gut, a lot of times I'll also put them on Echinacea Premium from MediHerb. Echinacea Premium from MediHerb is the best Echinacea supplement available. There's been lots of studies that show that it does work, and it's a modulator, so it doesn't just boost up your immune system or take it down. It does both. It modulates. So if you have hyperimmunity, it brings it down. If you have lower immunity, it brings it up. So it's a fabulous product for anybody suffering from any kind of immune problem, which again we'll talk about in step 4. But most people with gut problems have immune problems. A lot of these autoimmune disorders like colitis, Crohn's disease, these things are problems with the immune system, right? So we fix the gut and then we build the immune system. Hi, I'm Dr. Stephen Stokes. If you like the content of the video you just saw, you want more details, buy one of my books, available online. Heal Yourself, The 7 Steps to Innate Healing, which is all about nutrition, and The Philosophical Physician. You can't go wrong. If you have any comments or questions, ask below. I answer everything. If you're in the Fort Myers, Florida area, come on in and say hi. Thanks.